Hi, I'm Dr. Friedrichs, owner of Well Consulted. I thought I would talk to you a little bit about spinal decompression and how this may help people that are struggling with degenerative discs, herniated discs, arthritis, radiating pain, sciatic pain, radiating down the arms or the legs, or just chronic back pain, neck pain that just won't go away with maybe physical therapy or medical treatment or surgery or even chiropractic by itself, or injections. Those things, if they're not helping, or if they've helped you to some degree but you're still not where you want to be 100% wise, then spinal decompression may be the answer. I've been doing spinal decompression for a long time, since 2006. We actually were the first office to bring decompression to the state of Wisconsin. It was fabulous when it first came out, and it still is. It just does wonders. Non-surgical, non-invasive way to help people. So looking at, I've got models here. So looking at the vertebrae, these are really healthy. There are the healthy disc in between the two vertebrae that allows for these nerves to exit out in between each bone. That's very healthy. That's what we want to see on an x-ray or an MRI. Unfortunately, if you get to this point, this is where the disc is really degenerated, and you can see the difference between the two. And when it's really degenerative or where the disc might be sticking out, like you can maybe see a little bit here, that's a bulged or herniated or protruded disc. When that's happening, then it can irritate the nerve for sure, and that's going to cause a lot of pain. But it can also irritate these joints, and that can cause just back pain right in the center because of inflammation, because the joints are really like squished together, and they're not separated by a healthy disc. Think of a disc as like a flat tire, or think of it as a tire filled up with air, right? Or an inner tube. Let's say an inner tube is filled up with air, and that's great. You're able to bounce around and no problems. But when it's flat, the inner tube is flat, then you can't bounce around, right? You can't move around too well on a flat inner tube or a flat tire. So think of your disc as that way. If it's very healthy, it's like a pumped up tire in between the vertebrae here. That's what you want to have. And when it gets to be like this, then it's like a flat tire, and you can't move around too well. And so what decompression does essentially is when you lie on a spinal decompression table, we're actually separating the joints a little bit like this, just a little bit, and we pump it, and we kind of pump it up, essentially. It's what spinal decompression does. It rehydrates the disc. And essentially, it's like pumping up a flat tire, pumping up that inner tube, and then you get space between the bones. The discs elevate they're more hydrated, more fluid inside the disc as a result of spinal decompression therapy. That creates more spacing, so there's not so much stress or inflammation on the joints. And if it's a herniated disc or a protruded disc, it kind of sucks the herniation back into its normal positioning. And that's how spinal decompression works. It's really simple, but there's some fantastic physics that are involved with it that was designed way back in the early 2000s, maybe even the late 90s. Before then, there wasn't spinal decompression therapy, really, and it's evolved into such a fantastic form of non-surgical, very safe, no side effects of it, and it helps a lot of people. Like the studies have shown, like 84% success rate with lumbar spinal decompression therapy for herniated discs. I mean, it's amazing, without surgery, right? And without drugs. So if you're struggling with those kind of symptoms, by all means, why not check it out? So I'm here to let you know that I'd love to help you if you're struggling. I've been doing it for close to 30 years now, so a long time, right? And we've got experience. Our staff is great, and I love what I do. I'd love to help you, but only if you're serious about getting help. Then just give us a call. We'd love to see you in the office. All right. Hope you're not hurting too bad. Hope you're feeling great, as a matter of fact. Have a great day.